Good afternoon. Thank you for joining us. Welcome to our Tippecanoe County COVID-19 update. I'm Dr. Jeremy Adler. I'm the Tippecanoe County Health Officer. I'm pleased today to be joined by West Lafayette Mayor John Dennis, Lafayette Mayor Tony Wozworski, Dr. Wickert from Franciscan, Dr. Ramirez from the Protect Purdue Health Center, and Dr. Bean from IU Arnett. We'll start today with a brief review of our local Tippecanoe County COVID-19 data. The Health Department continues to follow 5 different data points related to COVID-19 in our county. The first is the number of new confirmed COVID-19 cases. The second is the percentage of COVID-19 tests that are positive. The third is the number of COVID-19 hospitalizations, including the number of patients in the intensive care unit and on ventilators. Fourth is the number of emergency department visits for respiratory illnesses. And fifth, the number of deaths due to COVID-19. This slide summarizes our current COVID-19 data. As of today, we have had a total of 1,245 cases cumulatively. In the last 28 days, we've had 443 new cases of COVID-19. In the last 7 days, 127 new cases of COVID-19. Of those cases, 399 are considered active. 835 individuals have recovered, and we have had 11 deaths in our county due to COVID-19. This graph shows the daily new cases of COVID-19 here in Tippecanoe County, going all the way back to March 18th, which was the first day that we had a confirmed case. And as you can see, the numbers peaked early in May, then dropped as May progressed and into June, and then as June came to an end, the numbers started to increase again and have followed, in general, a steady increase since that time. You'll notice that the numbers do go up and down with each day, so another way of looking at this is to look at the average daily new cases of COVID-19 by week, and this curve shows a similar shape with a peak at the beginning of May, followed by a decline and then a rise as June was ending, heading into July. And then here recently, our average daily new cases are at 15.4. So in the last few weeks, they've been the highest they have ever been since COVID-19 began. As for testing, here in Tippecanoe County, we have tested a total of 23,761 individuals. 5.2% of those tests cumulatively have been positive. In the last 7 days, 3,140 tests have been performed, and the percent positivity for the last 7 days is 4%. This figure is lower than the percent positivity for the state of Indiana and also for the country as a whole. So looking at our percent positivity and how that's changed over time, this graph shows that. You can see the percent positivity has decreased and increased over time, reaching its lowest point in mid-June and then increasing as we headed into July. A little bit of a decrease recently, then an uptick, and then down to 4% currently. The World Health Organization has as its goal to be 5% or lower, so I'm very encouraged that, at least for the last 7 days, our percent positivity has been below 5% at 4%. Looking at this curve, though, you can see that the number does tend to fluctuate, and so we'll be watching this closely as it may very well increase again. This next slide shows the peak COVID-19 hospitalizations by week going back to late May. The top line is the number of patients in the hospital, in our local hospitals, with COVID-19. The middle line is the number of patients with COVID-19 in the intensive care units, and the bottom line is the number of COVID-19 patients on ventilators. So that number is currently 16 patients hospitalized, 6 in the intensive care unit, and 2 on ventilators. So not the highest numbers we've had, but also not the lowest numbers. And lastly, our emergency department visits for respiratory illness by week. As you can see, that number has declined somewhat here recently, which is a good sign. Peaked in mid-June at 231 and is currently at 156. So we'll watch this number, as this is an indicator of potentially increase in COVID-19 cases if this number does go up. So to summarize, much as we've discussed in our previous press briefings, it's very important for all of us to continue to take action to keep COVID-19 under control in our community. As all of you are aware, we currently have no vaccine and no effective treatment for COVID-19. So our best weapons are all of the preventive measures that we've been discussing here in these press briefings for the last several months. We need to all wear our face coverings as mandated by Governor Holcomb. We should be avoiding crowds and maintaining a social distance of at least 6 feet when in public settings. It's important that we frequently wash our hands and we disinfect frequently touched surfaces. Individuals who are 65 years of age and older and those with high-risk health conditions should remain at home whenever possible. In addition, businesses should modify their operations and their workplace environments to optimize social distancing. With the increasing numbers of new COVID-19 cases locally, the upcoming large increase in our community's population due to the arrival of Purdue University students, and the COVID-19 transmission risks inherent in restaurant and bar settings, today I'm announcing a health officer's order pertaining to restaurants and bars. The purpose of this order is to put into place measures that are necessary to reduce the transmission of COVID-19 in Tippecanoe County. This action was approved by the Tippecanoe County Board of Health at their meeting on August 5th. The order will go into effect this Friday, August 14th, and applies to all restaurants, bars, and nightclubs in Tippecanoe County. In addition to the requirements contained in the Governor's Back on Track plan and executive orders, this order will continue Governor Holcomb's current capacity restrictions of 75% for restaurants and 50% for bars, provided adequate social distancing can be maintained. The Governor's capacity restrictions are set to expire on August 27th, and this order will ensure that this important preventive measure continues in Tippecanoe County. In addition, the order requires tabletop service for all patrons, and patrons must remain seated. No bar top service will be allowed in order to ensure adequate social distancing. The order also will require that restaurants, bars, and nightclubs close no later than midnight. And finally, the order will require that dance floors be closed and will limit gaming areas to participants only. This order may be modified if necessary due to changes in local COVID-19 data. The order will be posted on the Tippecanoe County Health Department website following this press briefing. It is my hope that taking these steps now will help curb COVID-19 transmission in our community and, importantly, allow these businesses to remain open. I'd like to also remind everybody that we still do have an Indiana State Department of Health testing site in our community. This site provides free testing without an appointment, and no doctor's order is needed. The testing site is currently at the former Happy Hollow Elementary School, which is serving as the West Lafayette City Hall. That's located on 1200 North Salisbury Street in West Lafayette. It's open Monday through Friday from 8 a.m. to 8 p.m. So to summarize, we are not out of the fight yet against COVID-19, and we all need to continue to be vigilant and stay strong in our resolve to battle this pandemic. Measures such as wearing face coverings, frequent hand washing, and social distancing are going to be our best weapons against COVID-19. At this point, I'd like to open the floor to questions from the media and questions from our Facebook Live audience. Thank you.
Hello, this is Anna from WLFI. I would just like to hear the mayor's response to this new health office order.
Well, as you well know, we have a very large number of folks who like to have an opportunity to wind down after a hard day at class. And some of it has actually been somewhat of a custom on campus. I could not be more delighted and supportive of what Dr. Adler has had the courage to do. One of the challenges that we knew we were going to be having when we were bringing our students back was trying to figure out the most logical and practical way to encourage the three major components, which is masks, social distancing, and washing hands, when they're outside of the area of the structured environment. One thing we knew for sure is that in the bars, the natural interaction once one has had a few drinks is that you lose your inhibitions, and the social contact becomes something more of a dynamic than what it usually does under the normal structure of social interaction. And there is no way for us to accurately police that. The way we have it now, we actually have rules that are basically encouraging the bar owners and bar managers and bar staff to keep a logical head count that empowers us to be able to make that assessment and then make some enforcement decisions predicated on that. It's exciting news. And again, remember, what we're talking about now hopefully will be temporary. The better we comply, the better we do the right thing, the better we do specifically what Dr. Adler is recommending, the sooner we're going to get through this. And this doesn't just apply to West Lafayette, it applies for the state of Indiana and the country. The rules are somewhat restrictive, and I know that can really create some challenges on the part of the students, some of the social interactions that they have, some of the ways that they let off steam after some challenging weeks in academics, and also in the event that there is some form of sporting event that they could attend, the challenges that go along with that too. But it's the right thing for the right reasons at the right time. And I could not be more excited about it, and I could not be more enthusiastically supporting of it.
I think Dr. Adler's made a good decision here, looking at the data and looking at where we're at as we begin to move forward. And I think this is a step that we can still work through. In fact, we're working with Dr. Adler's office right now, and I think one of the media already covered, we're working to extend outdoor seating through downtown Lafayette, down through Main Street, to allow the restaurants to try to continue at the level that they can and comply with this order, and to still do everything we can to keep them in business going forward. So I think it's another good example of people working together, trying to find solutions to keep the community safe, and as the community kind of finding solutions to try to keep our businesses as viable as possible. So I think the order will work well. I think it will work to achieve the goals to the best that we can, and can control what human behavior we can. And I think it's a good step, and we'll just have to continue to watch the numbers and be able to adapt and make decisions as we go.
Dave Banger with the Journal and Courier. Are there fines involved in this? What kind of enforcement? And was there any thought about restricting this just to near campus as opposed to countywide?
So as far as enforcement goes, as you're probably aware, that the health department does issue permits to restaurants and food establishments, and so the health department does have enforcement capabilities with these establishments. And the enforcement plan will follow the same enforcement strategy that Governor Holcomb outlined in Executive Order 20-10, where he authorized local health departments to enforce protective measures related to COVID-19 for food establishments. The first step, of course, will be a polite reminder with a written reminder, a written warning. The second step would involve a citation with a fine, and then the third step could, if necessary, involve revoking an establishment's permit. We hope to not need to do that. Thus far, that enforcement process has been applied in a couple of instances with regards to restaurant employees not wearing face coverings, and the enforcement has not needed to progress beyond step one, which is simply a written warning. So we've not had to institute a fine or revoke anybody's permit, and my hope would be the same with this order. The second part of your question was about just making this order for restaurants and bars that are immediately around the campus. That's an excellent question. I think in all fairness, to be fair, it needs to be applied to all restaurants and bars in the county. And also we need to remember that Purdue students can easily go to any restaurant or bar in our county and are not just patronizing restaurants and bars that are immediately around the campus. So I think that it needs to apply to all establishments in the county.
And if I may, there has been a significant amount of information in regards to this. And obviously, this isn't the first day of COVID. A lot of the students that are coming back, a lot of graduate students that are coming back, they are all familiar with some of the protocol that has been going on throughout the entire country for the past several months. So my presumption is that this will not come as any surprise. The challenges that we might have that's unique to West Lafayette is off-campus housing and then off-campus communal housing. That's still going to present a challenge to us, and obviously we're looking to do some proactive work there as well.
Question from Facebook Live. Do we have any data on how many of our cases are symptomatic?
Locally, I don't have that information. We can say, though, that based on some studies done by the Indiana University School of Public Health, that here in the state of Indiana, about 43% of individuals who have COVID-19 are actually asymptomatic. So I think that percentage is probably applies to our county also. And so that's one of the reasons why face coverings and social distancing and all these preventive measures are so important, because it's very, very possible to have COVID-19 but have no symptoms, and then, of course, inadvertently passing COVID-19 on to other individuals.
Anna Darling from WLFI again. This one's for Dr. Ramirez. Just want to know where Purdue is at on testing, how many students have tested positive, and I would like to know what the university is doing as far as the Greek houses, the fraternities and sororities. Are students living in those buildings?
So first off, we've sent out about 17,000 tests already. They're in process of resulting back. We hope to be able to publish a dashboard on Monday. At least that's what we're headed for. So we should have more details for you then. We've been working closely with the sororities, fraternities, and Greek houses and co-ops to try to make sure we keep good communication so that we can develop a plan should there need to be any changes in how we address any infections there.
Question from Emily with Journal and Courier. Regarding the recent number of schools across the state that have closed buildings and/or classrooms and have moved to some form of online instruction, how comfortable do you feel about the upcoming return for 3 public school districts in the county? And has your guidance for local schools changed at all?
Sure, that's an excellent question. And of course, everyone is concerned about that because our public schools here start next week, and we've all been watching the reports from around the state and around the country about schools that have already been in session and what's happened. And I think it really emphasizes the importance of the preventive measures that the schools have put in place to try to reduce the transmission of COVID-19 in the schools and protect everybody there. It's going to be challenging. It's really difficult to predict what's going to happen. We're going to take things one day at a time, and if problems arise, we'll address those, and the schools have put into place various measures, various plans that can be changed if they need to be, based on whether they have cases in the school or not. So we are going to be watching the situation very closely.
Question from Facebook Live. Can the mayor speak to the level of mask use they have been aware of and any enforcement issues?
Yes, since I issued my order early on, we've had a high degree of compliance. And insofar as enforcement issues have gone, we've been using our neighborhood resource team. And generally what they do is they encourage compliance, and they also provide, like what Mayor Rosworski is wearing, the paper masks in the event that they're not. The other thing that comes into play is there's a lot of social pressure. We get a lot of phone calls from citizens that are basically saying, you know, we're looking at this particular group or this particular operation, and they're not abiding by the mask standard. And again, we go out, and generally most people are willing to comply. It's just a matter of making sure that they're aware of how important it is for us as a community to do so.
I would agree with that. I think from me being out in different stores and taking a granddaughter school shopping the other day, I saw a lot of compliance. There doesn't seem to be too much pushback other than people that have indicated they have a medical condition. Seems to be from me talking to people in stores when somebody doesn't wear one and they ask that it's not so much, you know, you can't make me, as opposed to I have a medical condition that won't allow me to, or is covered in the exception. So I think for the most part, that's what I'm hearing. I haven't had any store call me in the last couple of weeks and say, you know, somebody's caused a problem, or, you know, and then I can't say that didn't happen, but I've not received any of those calls. So I think for the most part, people are getting used to it, and typically what we're finding, it's people that say they don't have it on because they have a medical exception that falls within the guidelines. Of course, you can't ask any further questions. You ask them to elaborate, but so you don't know quite for sure, but that's the one thing that we're hearing.
And one thing that I've learned since the beginning of the order is that as time goes by, people are much more willing to comply. Early on, after we did our local order, you'd go through a store and you would still see people walking around without masks on. I was in both Menards and Meijer this past weekend, and I didn't see anybody without a mask. I was in Payless last night, and this is on the West Lot. I didn't see anybody without a mask. So I think the local order and then the support of Dr. Adler, and plus people becoming more aware as time goes by, I think that's helped generate a lot of compliance.
Dr. Adler, just following up a little bit on the new order, does this apply to all restaurants or just ones that have alcohol permits? And should we expect any other kinds of restrictions, or is this really all about alcohol-related compliance and situations?
So the order does apply to all restaurants and bars, and so the order will require a continuation of the capacity restrictions that Governor Holcomb currently has in place, so 75% capacity for restaurants, 50% for bars. In terms of whether additional requirements or restrictions will be needed, will really depend on what direction our COVID-19 data goes locally. I certainly hope that we don't need to put in place anything beyond these measures, but you know, other communities have had to resort to that because of their COVID-19 data. So we'll be watching the data closely and modifying this order if needed.
Just to make absolutely sure, so places like a Steak and Shake that tend to be open late at night will have to close at midnight? Is that, this is not just about places that have alcohol permits?
That's correct, yes.
Question from Facebook Live. Dr. Ramirez, does Purdue have a plan to retest students periodically after they arrive on campus? Also, why are facility and staff not included in Purdue's requirements for negative tests before coming back to campus?
So first I'll address the faculty and staff. We have limited resources, so we needed to prioritize what our initiatives were going to be. And after long discussions, we decided that putting our attention into students and trying to be able to curb the infection rate and incidence of COVID-19 on our campus was top priority. Faculty and staff can request to go ahead and get tested. We do have the ability to do that. They're not required to do so. Most faculty and staff have been on campus and have been following Protect Purdue Pledge already. 58% of our staff are now working from home, and a large majority, there's quite a few professors that are also teaching online now. So we've really tried to curb the risk for those who are more vulnerable to being infected and having a severe infection. And I don't remember can you repeat the first question? I don't think I addressed the first question completely.
One second, let me go back. Do you have a plan to retest students periodically after they arrive on campus?
Yes, so we're working on a serial testing protocol, and as you've probably seen, a lot of other universities are also using similar protocols. We're trying to find what is our best strategy to be able to serially test not only students but faculty and staff as well.
The other day, President Daniels has put out videos and has told media that if we get to Thanksgiving, it will be a real feat. What do you think the odds are of Purdue making it that far, and also local schools making it that far as we prepare? And same question we asked a couple weeks ago, is there a number or a metric or a way that community can know that it's time to pull the plug on either of those situations?
Well, it's really hard to know what's going to happen next week, let alone what's going to happen, several months from now. So I don't know if I can put an odds on making it to Thanksgiving. I certainly hope that we do, but it's going to really depend on what happens with our COVID-19 data here locally, and whether we end up seeing significant surge in our local COVID-19 cases, or whether we maintain adequate levels of low levels of COVID-19. So very hard to predict. Like I said, it's hard to predict even what's going to happen next week. The second part of your question was, about whether there's a specific metric. Yes. Also difficult to answer because, the 5 data points that we're monitoring as a health department that I've shared with you today, it isn't necessarily one particular data point that would lead us to a major decision like that, unless there was a really significant change in one particular data point. It's probably going to be more a combination of these different data points, and there are various, so many numerous combinations or permutations of this data that could lead to needing to take different steps, and so we'll be watching these trends closely, and we monitor them really on a daily basis. And if we start to see things moving in an unfavorable direction, then our first question is, what can we do to turn things around? Is it possible to turn things around? And if other steps are necessary, then we'll have to make those difficult decisions when the time comes.
Question from Emily Seiberg from WBAA. As collegiate sports seasons are postponed, could area high school level fall sports seasons also be postponed due to COVID-19 concerns, and when might that become necessary?
Well, that's another excellent question, and we're actually awaiting guidance from the Indiana High School Athletic Association, IHSAA, about that very topic. So we'll have to wait and see what they recommend with regards to school sports.
This one's for Dr. Bean and Dr. Wickard. Is there any kind of, as the flu season approaches, is there anything that you guys are hearing about this year's flu and how it may impact coronavirus?
Perfect question, well-timed. So what are we hearing? It's coming. And I can tell you that we, within IU Health, have over-ordered flu vaccines for not only our healthcare provider population and our patient population, but we're also going to have limited ability to help support vaccination beyond that against flu. Do we know if it's going to be a bad season or a moderate season? That's hard to predict until we're in it. I think there's shared concern that on top of COVID, it's going to potentially be quite significant and put much pressure on the existing healthcare resources. There's also some argument that for communities that are doing a great job with the public health efforts that we've continued to reiterate, we might actually have an effect on flu transmission as well. So I think there's cause for serious concern and preparation, but maybe a little bit of hope that it won't be as bad as it could be.
From my standpoint, I think it'll be an interesting fall season for physicians as they see patients. And is this the flu? Is this COVID? Is this respiratory virus? Is this a strep throat? Is this what is it? And we just keep adding potential infections and potential testing that we will do for individuals. So this will be a very interesting fall season as we sort this all out and figure out who gets which test for which purpose and which reason to try to identify what is the underlying cause for their problem.
Question from Facebook Live. With the new directive from the county, how will this impact game rooms such as pools and arcade rooms at the bars? And what is the next option under consideration by the county and cities when Purdue drinking culture moves to private residents?
So to answer the first part of the question, gaming rooms or games such as pool tables, darts, are still allowed in bars and restaurants. However, those areas should only be occupied by the people who are actually participating in those games. So in other words, the person who's actually shooting pool can be at the pool table. The others who may be playing should be seated or off to the side, socially distanced appropriately. There shouldn't be large gatherings of people around a pool table or around a dartboard. So those games are still allowed, but of course with reduced numbers of individuals in those areas. As for the second part of the question, which was in regards to off-campus drinking, I may ask our mayors to chime in on this. That's a difficult issue faced by every college town because it involves, of course, private property and other laws that are outside of the purview of the health department.
Well, actually, we've got a really strong relationship with our neighborhoods and our neighborhood associations. A lot of the properties have been around almost since the time of Purdue, and the neighborhoods have grown up around the university. And that comes with great bonuses and then a few liabilities. And one of those liabilities is the people of the experimental years, which are anywhere from 18 to 25, which just coincidentally happens to be the college undergraduate years. It creates challenges for the neighborhoods. It creates challenges for local government. But we have a very strong relationship with our neighborhoods, and they are very familiar with the protocol to abide by to make us aware of certain circumstances and situations that might be either harmful, now with COVID in the mix, and in prior years just disruptive to their quality of life. And we've got units that respond specifically to that. We're very fortunate in West Lafayette and on Purdue to be able to focus resources on those quality of life issues, and we're very in tune to doing that. We've done it for quite some time. The challenge comes with people wanting to report. because again, a lot of the houses that are being rented by students were formerly occupied by families and are in a residential area. And some of the residential folks are patient and tolerant, and some are not. But with the new world of COVID, I think that we're going to be getting a lot more notifications, and our enforcement personnel, both police, fire, and neighborhood resource teams, are acclimated to respond accordingly.
Okay, I mean, I agree with John on that. We're going to do our best, but Dr. Adler's also right. When it comes to private property, whether it's Purdue students or a group of adults, I mean, if people don't open the door for us, there's only certain reasons you can force your way into somebody's private property. So we'll enforce state laws to the best of our ability, and we will certainly advise people, but I don't want to create in folks' minds out there that we have some magic wand that on private property we're going to be able to clear up every issue that takes place, whether it's Purdue students or adults. We will do the best that we can to continue to advise people and enforce state laws as we can. But private property, private and individuals' residence, it makes that a very unique situation.
A couple of questions about reporting for Dr. Ramirez. What will be on the dashboard that we see on Monday? And then will there be a similar kind of dashboard or reporting mechanism for K through 12 here in the community so people can keep track of what's happening at the schools?
Our data is going to be very similar to what the county reports, except for, of course, it'll be mainly around our Purdue students, faculty, and staff.
As for K through 12 data, currently we plan to continue utilizing the state's dashboard, and I believe the state may be dividing some of that data out as the schools begin. So we'll see how their dashboard handles that, and if we need to do something differently here, we can look into that possibility.
Question from Facebook Live. Since there is no treatment for COVID-19, what are doctors doing for those who present symptoms?
So that is correct. There's no specific treatment for COVID-19. So the treatment is largely supportive care. So that includes things such as rest, fluids, medicines for fever or for pain. For patients who are in the hospital, that could include supplemental oxygen, IV fluids. Some patients who are in the hospital get experimental treatments such as remdesivir. They may get steroids. They may require increased respiratory support depending on the severity of their symptoms. Dr. Bean or Dr. Wicker, did you want to comment also?
The only other one we're using is convalescent serum plasma from individuals who have had the infection, have recovered, and now have antibodies within their blood that can be used to supply and give to individuals who have the infection to help them recover from the infection.
That's an opportunity for those who have recovered to seek out a place to donate and to contribute to the supply of sera that we can use in treatment.
Question from Facebook Live. Is drive-through services allowed after midnight?
So the current order essentially closes restaurants and bars to their customers at midnight, no later than midnight. Yes.
Question from Emily, the Journal and Courier. Should cases start inside schools here, how are you prepared to handle the kind of approach? What lessons have you picked up from other schools opening in the recent weeks in Indiana?
Okay, so we've been working along with several of our local schools and their nurses to come up with processes and protocols that we'll follow to make sure we're communicating with each other, getting the information that we need from the school and they need from us, so we can coordinate contact tracing, coordinate quarantine of appropriate close contacts. So that is, as you can imagine, a process that involves a lot of moving parts and a lot of coordination. So we're working through those processes right now. I think, the fact that other school systems have already seen positive cases within in some cases, their first day of being open, indicates to us that that likely could happen in one of our local schools, and so we want to be ready for that possibility should it arise here in the next week or two.
Just one more question on the order. Is this indefinite, or is there kind of a game plan to say, we'll review this at a certain point? And also, does it stay in place if the governor goes to stage 5?
So the order does not currently have an expiration date, but we are reviewing our local data on a daily basis, and we'll make modifications to the order depending on what the data shows. We don't want this order to be in place any longer than it needs to be in place, but it's hard to predict right now how long it would need to stay in place. We just don't know what direction COVID-19 is going to take, here in our community over the next several weeks, next several months. This order would stay in effect if the governor does progress the state to stage 5. That was one of the reasons for making this order. The governor's current capacity restrictions are set to expire on August 27th unless he renews them. We wanted those capacity restrictions to stay in effect here in our county, even if the governor does allow, through his executive orders, stage 5 to occur. The governor does allow for local governments, local municipalities to enact requirements or restrictions that are more strict than the state requirements. They just can't be less strict than the state's requirements.
And just one more clarification on that. Given the thought process of this with students coming back, and we've talked about student behavior at bars and that kind of thing, is it fair to say that this is going to last as long as Purdue is in session until we get a vaccine?
I think it depends on what direction the COVID-19 data goes. We just don't know. If the numbers continue to remain at high levels or increase until there's a vaccine, then we'll probably need to have something like this in place until that time. If, on the other hand, if other preventive measures that we've been talking about bring our numbers down, we may be able to rescind or lessen this order in the future.
Question from Facebook Live for Dr. Adler. Are you confident that sufficient testing is going to be available with the local schools opening and the arrival of Purdue students?
I believe so. The Indiana State Department of Health free testing site that's currently operating in West Lafayette at the former Happy Elementary School is currently running about 250 tests per day, which is a really good testing capacity. In addition, both of our local hospitals have drive-through testing sites that I think can handle a large number of individuals. As for Purdue's testing, Purdue has an excellent plan where they're providing adequate testing for their population. Dr. Ramirez, did you want to comment on that?
So Purdue has 3 partners, lab partners that we use. We use Rutgers University, and also we use at Purdue, we have the ADDL, or Animal Disease Diagnostic Lab, that is private to Purdue, so we have that added capacity. We also have an additional partner as was announced a week or two ago, CVS as well, and they've been doing a great job as well. So we've been able to use those as our main venues, hopefully relieving some of the tax or the bottlenecks that can develop in testing.
Last question from Facebook Live. Would you consider lowering the threshold for a fever at local schools to something other lower than 100.4?
So the threshold of 100.4 is what the CDC and the State Department of Health utilize as their threshold for a fever. So we would intend to remain consistent with the CDC and State Department of Health definition for fever. Certainly, if they change that definition, we would change along with it. I believe that's all the questions for today, so I'd like to thank everybody for coming, and we'll see you next time. Thank you.
Good to see you.
Good to see you as well.
Yes. Yeah, the order only.
I guess I didn't catch if there was a morning time.
Yeah, there's no restriction on what time a restaurant or bar, bars that have a restriction anyway for what time they can open.
But I mean, like the drive